What's your thoughts about the European Union recommending that the 27 nations reinstate restrictions on tourists from the U.S. because of our increase in COVID infections?
You know, I can't speak for what the European Union is deciding. You know, we obviously are in a difficult time right now with a surge in infections. Hopefully, we're going to get that under control by our accelerated activity in getting people vaccinated. But, you know, it's not up to me to comment about what the European Union is deciding.
Were you surprised, though, that they made that recommendation?
You know, again, I don't want to comment on it because it'll get taken out of context. So I really don't want to do that.
Okay. We keep hearing about boosters, and you say 8 months from the second shot is just an estimate, but you're still waiting on some data in regards to that. What would be the harm, though, if someone did get a booster sooner than that?
Well, I don't think there would necessarily be a harm. There's no indication that that is the case, but you want to always make science and data determine your decisions. And it's for that reason that the data that's involved with the durability of protection and the effect of boosters is being submitted to the FDA, which will examine it. It will then go over to the Advisory Committee on Immunization Practices, which then advises the CDC as to the implementation of recommendations of when and whom to boost. So if we just take things in their orderly step-by-step fashion, we'll get it right. So right now the plan is to do it for individuals who are 8 months out, starting on the week of September the 20th. But as I mentioned, as data come in, that's a flexible time. I think what will happen is that we'll look at the data, particularly the Advisory Committee on Immunization Practices, and they likely will give a bracket of a range of optimal times to vaccinate people. I think that's what's going to happen.
To what degree do you see this virus mutate to the point that you have to reformulate a vaccine going forward? Will we see vaccines targeting certain variants like the flu every year?
You know, I don't think you're going to have to specifically go after a given variant. And the reason I don't think so is that in studies on boosters already that we have done here in the United States and that the Israelis have done even much more of, because they are boosting already and have some considerable data on boosts, is that when you boost the person, for example, who've received an mRNA vaccine, the two, either Moderna or Pfizer, and you boost them several months later, you get a very, very sharp increase in protection, even against Delta, despite the fact that the boost was against the original virus, which is an alpha or another variant. So it is quite conceivable and maybe likely that you won't have to go chasing after each individual variant with a different vaccine, that you could vaccinate with the original vaccine and get antibody levels that are high enough to cover all of the variants. In fact, that's what we're starting to see right now. We're certainly seeing that in Israel.
As this virus mutates, it does appear to be getting stronger, certainly more contagious. Is there anything you're seeing that's particularly concerning to you?
Well, the concern is that it is a very, very transmissible virus. I mean, the Delta variant now comprises 99% of all the isolates in the United States, and it has really taken over the world with regard to isolates. So about 120 countries now have Delta variants in their country. So the concern is what we know. The fact is that the Delta variant transmits from person to person much more efficiently than previous variants. And when you do get infected, the level of virus in your nasopharynx, which what we refer to as the viral load, is very high, which explains the reason why it's so easily transmittable.
And I talked to you many months ago when this pandemic first started, and I asked you if you thought this was going to be endemic, and you said it was likely, but that it would come to a point where it will be manageable. When do you expect us to be at that point where we know this is not going away, we're not going to eradicate it, and we're just going to have to manage it the best we can?
Well, I think we can even do better than that. It depends on the percentage of people that we get vaccinated. We now have highly effective and safe vaccines, more than one. 3 of them have been given approval, 1 with a BLA and 2 with emergency use authorization. And there are about 80 million people in this country who are eligible to be vaccinated, who are not yet vaccinated. If we could get the overwhelming majority of those people vaccinated, we will get to a state of a very low level of transmission and infection that likely would not interfere with our way of life and how we do things. So hopefully we can do that. It's within our power.
Well, then how do you explain some of these breakthrough cases with people who have already been vaccinated? Because
Well, you get a breakthrough case because there's a lot of virus circulating in the community. Once you get a lot of people vaccinated, the level of virus is going to go way, way down. And you're going to see a dramatic diminution in breakthroughs. Since no vaccine is 100% effective, when you have a lot of virus in the community, even vaccinated people can get breakthrough infections, which is what we're seeing. But if you bring the total level of transmission in the community down, you're going to see less and less breakthrough infection.
Is it safe to say that even if 100% of people were vaccinated, this still would not be, we could still not eradicate this virus?
Well, that depends on what's going on in the rest of the world, because we're not in a vacuum here in the United States. We hope we get the overwhelming majority of people in the rest of the world. I can tell you, if 100% of the people in the world were vaccinated, we wouldn't be having this conversation. There would not be an issue.
I want to ask you about these breakthrough cases, because right now the only ones that are being reported are the ones that are people who are hospitalized or deaths. But we're still seeing positive cases reported. Shouldn't we also see of those positive cases, which ones are breakthrough cases?
Well, yes, that's true. And that's the reason why the CDC, which was not following breakthrough cases that were asymptomatic, is now starting to do so. So that's a good point.
Was that a mistake?
Oh, I don't think it was a mistake. I think it's just at the time it was very clear that we were not dealing with the Delta variant. And the Delta variant is the bad actor that spreads even with an asymptomatic manner much, much easier than the Alpha variant.
Dr. Fauci, President Biden's intelligence team could not definitively find the origin of COVID. And you said, you know how important it is to find that to avoid this in the future. But how in the world can we find the origin of COVID if China is not going to cooperate?
Well, that's a very good point. I mean, I think what we need to have is a good scientific collaboration, a diplomatic collaboration, and a forensic collaboration, because probably the way you're going to find out is to have access to the animals in the animal markets, to be able to screen them, to see if they are harboring viruses that's closely related to SARS-CoV-2, as well as do serological studies in China and find out where it may have actually penetrated into their society. So there are a lot of things that we can do with cooperation from the Chinese.
Right. And during an earlier event called United Facts of America, a festival of fact checking, you were asked if you were still confident that the virus evolved naturally. And you said you were not convinced about that. You said you thought that we should continue to investigate what went on in China until we continue to find out to the best of our ability what happened, right? So what changed your mind?
No, nothing changed my mind. I think that statement was taken out of context. I have always felt and feel right now that the very likely explanation of the origin was a natural evolution from an animal reservoir. But until you've definitively proven that, you can't say that you're absolutely convinced that it's that. So saying that something is possible doesn't mean that it's probable. What I was saying that it's possible that it could have been something that evolved from a lab. That doesn't mean I meant it was likely. So when you go back to what I had said in answer to that question, are you convinced? Convinced means you're 100% positive. Since you're not 100% positive, you can't say you're convinced. But I still believe that the very likely explanation is an origin from a natural occurrence, from an animal reservoir to a human.
And of course, you have denied any money that came from NIH went to fund gain of function research. But there is a little bit of acknowledgement, right, that there's no way to know whether scientists at the Institute conducted gain of function research outside the scope of the grants it received through EcoHealth, right, the nonprofit that got its funds from NIH.
Yeah, well, I can just tell you that the small amount of money, about $120,000 a year, that went from EcoHealth were for very well-defined experiments. that were not gain of function, the results of which were given in annual reports and were reported in the open peer-reviewed literature. So I'm convinced that the grant money that was given to do experiments that were worthwhile experiments and that gave us good knowledge were fine. No one, to my knowledge, at least nobody that I'm familiar with, can give you an absolute guarantee of what went on in Wuhan in other areas unrelated to what we were involved with.
And at this point, as we move forward in this next phase of the pandemic, you have said that you believe spring of 2022 is when we might see a little bit more normalcy. What are your key indicators? What are some things that you were looking for in order for us to see that come to fruition?
Yeah, that's a good question. The thing that's the foundation of that is that we really need, between now and when we get into the winter and through the winter, get the overwhelming majority of the 80 million people who are eligible to be vaccinated who have not yet gotten vaccinated. If we get them vaccinated and we get through the winter, which is going to be complicated by influenza and respiratory syncytial virus, if we can do that successfully, as we emerge from the winter, I think we have a very good chance of being in good shape as we get into the spring.
Yeah, and it's always amazing to me that you yourself have not ever contracted COVID, correct? You've never tested positive.
I've never tested positive, but I'm doubly vaccinated, so that's helpful.
Yeah, and you've never had a breakthrough case, which we know there have been people who have been doubly vaccinated,
Right.
and that's quite amazing. So is there anything that you would tell the American people they should do to ensure they can stay healthy and safe this winter?
Well, I think as long as we have the amount of circulating virus that we're seeing now, like yesterday, we had 154,000 cases in this country, which means we're on an upsurge. And when you're on an upsurge, even though you are vaccinated the way I am, and I hope you are, even though we are vaccinated, I think there are certain precautions that you can take. You can avoid crowded indoor places. And if you have to be there, you should wear a mask in a crowded indoor place if you're living in a part of the country that has a high level of virus circulating. And if you look at the map of the country, with very few exceptions, that's just about everywhere. So right now, you really need to be careful. As long as that level of virus is way up, when the level goes way, way down, then you could feel much more comfortable in being flexible.
And finally, very quickly, because you did mention the masks, there's all this talk about how these cloth masks don't work. It might create a false sense of security when the N95 masks are really the effective masks. What's your thoughts when you hear stuff like that?
No, I think just wearing a mask, regardless, cloth mask, surgical mask, N95, some people talk a lot about N95 masks. Obviously, they're very good, but they're much less comfortable to wear than a standard surgical mask or a cloth mask over it. I think the important thing, instead of quibbling about what kind of mask, just wear a mask. That's all.